Tonight, an alarming new report on Robert F. Kennedy Jr., the person Donald Trump wants to put in charge of the country's health. In May of 2021, that's just 6 months after the rollout of the COVID vaccine, Kennedy tried to stop all COVID vaccinations in the U.S., the New York Times reports. He did this during a deadly phase of the pandemic when thousands of Americans were still dying every week. Kennedy's anti-vax organization petitioned the FDA to completely revoke authorization for the vaccine and refrain from approving any other COVID vaccines in the future, even though estimates have begun to show the rapid rollout of COVID vaccines had already saved about 140,000 lives in the United States. Senator Ed Markey, Democrat of Massachusetts, is on the Health, Education, Labor Committee, which is one of the committees that will be holding hearings on RFK Jr. for Health and Human Services Secretary, and he joins me now. Senator, obviously we've known RFK Jr.'s position on this. This is new news that this petition actually happened. We've got global estimates that in that first year, the vaccine saved the lives of about 19 million people. What do you think this says about his qualifications to be the head of HHS?
Well, it only reinforces all of the doubts that have already existed about his candidacy. He's questioned the vaccine for polio. He's questioned the vaccine for measles. And by inference, it also is mumps and all of the other diseases in our country and around the world that in the past 2 generations, if they haven't been completely eradicated, they've just been reduced down to a dramatically lower number each year that affects families in our country and around the world. And what Robert F. Kennedy Jr. has done is that he is putting a cloud over vaccines. He's allowing for doubts to be raised in families' minds as to whether or not they should be vaccinated. The COVID vaccine, if it had not actually been distributed, would have led to another 800,000 deaths in our country. And here he had a petition to stop the distribution of the vaccine. So from my perspective, this is just one further reason why 75 Nobel Prize winners have come out in opposition to Robert F. Kennedy's confirmation as the top health official in our country. And it's why this is going to be one of the most important confirmation hearings that we have had in a generation in the United States Senate.
Just to stay with us for a second, I mean, you talk about polio and other things. I mean, one of the things that's so wild to me about this is that we actually we lived through this with COVID. Like, we got to, people couldn't leave their homes. We were outside. It was killing thousands of people a day. And the vaccine, the country got vaccinated enough that we didn't have that anymore, more or less. So here's my question to you in a technical sense. I mean, if he were the head of HHS and we had another pandemic, which I know no one wants to think about that, but 100% could happen, he would have the power to do things that would stop the development of vaccines for that virus, stop the deployment. He would have very real power to make it impossible to vaccinate people, right?
I'm not predicting this, but if for the sake of this discussion, there was a bird flu pandemic that broke out in our country, and we needed a vaccine, and we needed it to be distributed, we would need a secretary of HHS that was leading the charge.
Yes.
That was out in front and recommending to people, especially those who might be in the most vulnerable communities, that they take the vaccine. And instead, based upon his past history, I think it's pretty clear that he would not be doing that. In fact, he'd be raising questions about the safety and efficacy of that vaccine, which would be very dangerous to the communities which could be potentially threatened.
That petition we mentioned before claimed the risks of the vaccines outweighed the benefits, that vaccines weren't necessary because good treatments were available, including ivermectin and hydroxychloroquine, which subsequently, through multiple studies, has shown to be not at all effective at all. And they had already been deemed ineffective against the virus at the time in 2021. There's been subsequent data, so this is just essentially nonsense. Go ahead.
I said he's moving us away from acceptance of vaccines, acceptance of fluoridation as a part of the healthcare culture in our country. And by the way, distracting us from what the real agenda of the Republican Party is, which is to loot Medicaid. to loot the Affordable Care Act and all of the health care programs for ordinary families, for poor families in our country, to pay for the tax breaks of his billionaire buddies down in Mar-a-Lago. That's what we should be debating, not the efficacy of vaccines. And that's really at the heart of the problem of this Kennedy nomination. We are being distracted from the real issues and the real agenda of the Republican Party, once again, which is to pay for the billionaire tax cuts.
All back. I want to read some of what this intake form looks like, Vaughn, if you want to work at the Health and Human Services Department for RFK Jr. Quote, the Make America Healthy Again intake form is certifiably comedic and a little gross. This is according to Puck News. The form asks candidates to answer questions by selecting responses such as, quote, I don't have much interest in having sexual experiences with another person. Quote, I believe in things many others don't, like having a sixth sense, clairvoyance, and telepathy. I don't even know how you say that one. I clearly don't have any. And as an adolescent, I had bizarre fantasies or preoccupations. And this, quote, I consistently use my physical appearance to draw attention to myself. When I reached out to the Trump transition team for comment, spokesman Brian Hughes confirmed the page is real and being used by Kennedy's team. What is the question? I consistently use my physical appearance to draw attention to myself, designed to attract or repel. I'm asking a serious question.
Yeah.
Is the answer designed to bring people in or push people out of HHS?
I think that there is a. I wish that I had a more specific answer for you, Nicole. Besides saying that, I think that there's a certain group of people that are around Robert F. Kennedy Jr. They have a following online, on podcasts that frankly has been elevated from fringe to a certain level of mainstream. And I think that there is an understanding of there's a certain small pocket of people that they entrust to work at the highest levels of HHS, CDC, FDA going forward here. But I think when they're looking at who's going to fill the roles of these political appointees on down, of which there are hundreds within the HHS, I think that is where these questions become pertinent.
Let me see them.
And I think that
let's do it.
I want to believe you're reading it wrong because it doesn't.
I mean, you're a doctor, Dr. Anderson. I don't have much interest in having sexual experiences with another person. What information is it a management question or a medical question?
You know that it's rare that I'm at a loss for words. I'm just kind of coming up with other things on the checklist, like, do you have experience in taking care of patients or in public health or in making sure that kids are safe and well cared for? So I have no idea what that one means, but I would sort of like to add a couple others that I think maybe weigh a little bit more.
I think that's such a good answer, which is that, right? It's not just that this is wild. It's that there's an opportunity cost in not using the correct filter and not actually asking if someone, which is something we have seen with most of his nominees, right? Number one, do you have the experience and competence necessary in order to do this, to get this job done? Number two, are you fit enough to actually execute this job? That's sort of a testament. It's as though he used that same questionnaire on all of his nominees.
But that's the threat. The threat is that we are beginning with all of his nominees to normalize the absurd. I mean,
we're not.
Not we, but I'm saying they're moving the country there. The more they get away with this being done in terms of questionnaires are being said, and people are told, well, let's not talk about it or let's not deal with it. That normalized. This is not normal stuff. To ask people that are going to work at FDA or Health and Human Services about their sexual activity is nuts, and we need to deal with it like that.
I guess I don't want to be without curiosity about why Trump is attracted to this and why the voters who selected him, and he ran with RFK, so they knew this was part of the deal. I think this
is a disaster for RFK Jr. and for Trump. They had two rules for RFK more than the other people because he's so outspoken and he's quite famous. The whole thing was keep your friggin' head down and no more scandals. because you're already on a knife's edge. He's one of the 4 people on a knife's edge. And look, surprises could happen, but it's Hegseth, it's Kash Patel, it's Tulsi Gabbard, and it's RFK Jr. And the RFK Jr. is in a tough position because he's taken some crazy positions on the far right in terms of anti-science positions that make a lot of the more reasonable Republicans, and there's not very many of those, but makes the less insane Republicans nervous. But he's also taken pro-choice positions that I think many of us agree with on this channel that piss off Republicans. So he's in a uniquely precarious position where he's unqualified, woefully, for the position, but Republicans have right-wing reasons to oppose him as well. So you could see him losing like a Tuberville, like a crazy far-right Republican being like, yeah, he's pro-choice, I don't want to vote for him. Sorry, President Trump, you can find somebody else. You know what I mean? You could see that. No scandals. And then bam, a massive scandal showing not only his plans, but some breaking news that he has taken shocking positions recently. One of the arguments for RFK is that a lot of his craziest positions were in the past, and he's learned and he's moderated. But what this demonstrates is that just in recent weeks and months, he's taken awful positions, and the questions he's asking people as he approaches this, as confirmation starts, indicates he might be one of the most radical picks, in a bad way, we've seen in a long time.